ventilator have two types of oxygen. The first is the high pressure. This one is high pressure oxygen on the top, okay? And lower part is low pressure oxygen. Okay, it connect with the small oxygen tube and connect with that flow meter. And usually we use the low pressure only in transportation. Okay, if you would like to transport a patient, we connect the oxygen with the low pressure, okay? But if the patient already transferred to ICU, we connect with the high pressure one, okay? So that's why this patient connect here, okay, high pressure, and connect with the oxygen cylinder. Okay? So for this cylinder, we screw these things to open the pressure, okay? And we need to keep this pressure around 50, okay? So we can see the needle now here is about 50, okay? So it should keep 50, okay? So everything is connected and connect with the power, and this is a switch on and off button here. So I already pressed this button, okay? So after pressing this button, we can see this screen. So now means that this is a systemic check, okay? Before we start using the ventilator, the first thing we need to do is to do the pre-use check, okay? Every ventilator have the protocol about how to do the check, okay? But we don't need to remember it, we just need to follow the rule on the screen, okay? So the first is that please connect the high gas oxygen cylinder. So we already connected and turn on, and block white piece. Okay, so this is a white piece over here. I need to connect. Usually when we do pre-use check, we usually bypass the humidifier. Okay, so just connect all two here, like this one. Okay, and then block white piece. Okay, connect the white piece here. You can use, sometimes we use hand to block, that's fine, okay? And then press continue. And usually it runs automatically, so we don't need to do anything, we just follow the next step. It will show the message around, I think here or here. And usually we do this pre-use check before connecting the patient. Sometimes we don't have patient, but we can do the pre-use check first. And if the patient comes, we can directly use the ventilator. Okay.
It's passed.
Yeah, it's passed, yeah, because this audio sensor is well, functioning well. Okay, so, okay, it's this. That's it. Okay, and then is to set this is called initial setting. They have some steps. The first step is pre-use check. Second step is set the setting. And third step is set the alarm. Okay, alarm setup. Okay, so now it's a second step, initial setting. Okay, so this is a new patient, maybe it's a male or invasive, and this is ideal body weight. I have another lecture talk about how to calculate ideal body weight. I think you can find it on the website. They have a lot of equation talk about how to calculate it, and usually use height, use the patient's height to calculate ideal body weight. Okay, it's not the actual weight. Okay. So okay, maybe ideal body weight is 70. Okay, that's fine. Pass or to therapy. Okay. And then is to set the ventilator mode. So they have, usually we set the volume control or pressure control here. In our hospital, we usually use the pressure control first, but that's fine. All the things are fine. Okay, so let me see the pressure control 15, 12, 14, 12. FiO2, it depends on patient. Okay. More setting. Off. I can talk shortly about each parameter, but I have one lecture talk about all of the setting. Okay, I just briefly talk about that. The first is volume control this mode, and this mode it deliver tidal volume, constant tidal volume to the patient. Okay, so we need to set the tidal volume. Okay, and usually the tidal volume is around 6 to 8 ml per kilogram of ideal body weight. Okay, not actual weight. You use ideal body weight to calculate this tidal volume. So for example, like this patient, ideal body weight is 70. Okay, so the tidal volume, how much should we set? I set 8.
8 times 7.
Yeah.
560.
500. Yeah.
560.
8 times.
Yeah, 8 times
70.
Yeah. So 500 cc. Okay, and so according to ideal body weight to set this value, and frequency is our normal respiratory rate. So it's around 12 to 20. Okay, and we usually start from, I think that's fine. 12, 14, 16. That's fine. Okay, so I said 14, and inspiratory time. This value is around 0.8 to 1.2. Okay, if the patient like a COPD or asthma patient, they easily get air trapping. Means that the air can in, but it's hard to breathe out. Okay, so if this patient, if you have this patient, we need to shorten inspiratory time in order to prolong the expiratory time. Okay, to prevent air trapping. Okay, so for example, like a COPD asthma, maybe you need to set 0.8 or 0.9. Okay, but for other patient, you can set 0.9 to 1.2. Okay, so this is a range, 0.8 to 1.2. Okay, so I say usually we start from 0.9 over 1. I think it's easy to remember. Okay, and PEEP usually is start from 5. Okay, sometimes some hospital, for example, in our hospital, sometimes we start from 8. But usually in some patient like a head trauma, because they easily to increase intracranial pressure, so we need to decrease the intrathoracic pressure. So we cannot set the PEEP too high because the venous return, it can affect the venous return. Okay, so if like the patient with head trauma or increased intracranial pressure, sometimes we start from 5. But if the patient is obstructive lung disease or ARDS, acute respiratory distress syndrome, sometimes we can start from 8. Okay, and one absolute contraindication to use PEEP, just one, is tension pneumothorax. Okay, so if we see the patient had tension pneumothorax, we need to decrease the PEEP to 0. Okay, this is one absolute contraindication to use PEEP. Okay, so in normal people, we can start from 5. Okay, that's fine. And FiO2 is according to the saturation. Okay, to do titration. And usually, if we don't know the patient's saturation, we can start from 40 to 50. Okay, not too much. Okay, and do titration after connecting the tube to the patient. Okay, and another setting is, I think I already talked about that. Another setting, let me see. Okay, this is assist should be on, and this is assist means that the ventilator can sense patient trigger. Okay, so if we turn off this setting, okay, this means that the ventilator can only deliver 14 breaths per minute. Okay, but when we turn on, means that it can sense the patient's breathing. Okay, so if the patient's respiratory rate now is 20, but we set 14, right? And the ventilator, because we turn on this, so the ventilator can deliver 20 breaths. Okay, do you know what I mean? Okay.
Yeah.
Okay, so this one should be turned on. Okay, and usually we can set that this is a trigger limit. means that the 2 is fine. Usually is 2 to 3. Okay, this trigger limit, and this trigger limit is the sensitivity to sense the patient's trigger. Okay, so if this value is low, is 0.5, is 1, or is 2, means that the ventilator has high sensitivity to sense the patient's trigger. Okay, if we set 5, 6, 7, 8, means that it's hard for the ventilator to sense the patient's trigger. Okay. Okay, so this is a volume control. So we can start from volume control, and different from that, the pressure control is that because the volume control, it delivers constant tidal volume to the patient, and pressure control means that it delivers constant pressure to the patient. Okay, so the difference, all the settings are the same. Just one parameter is different. Is the pressure. When you see the pressure control, we need to set the inspiratory pressure here. Okay, and when we see the volume control, we need to set tidal volume here. But the other things are the same. Okay, so if we like to change to pressure control, usually this inspiratory pressure, you can see that they have a delta over here. Delta means that this pressure is above peak. Okay, so the peak value now is 5, right? And the pressure is 50, means that the peak inspiratory pressure for the patient is this value plus this value, so it's 20. Okay, so usually we need to keep the this is called plateau pressure or peak inspiratory pressure below 30 centimeter water. Okay, so when we peak set 5, the highest value for this value is about 25, because these two values combine, these two values should not more than 30. Okay. Okay, and we usually use start from maybe from 10 to 15, and to do titration to see the tidal volume, whether this pressure can reach the tidal volume around 6 to 8 ml per kilogram. Okay. Okay, so that's it. And another setting is alarm. Alarm setting is over here. But usually the alarm setting is fixed setting. Okay, we don't change the alarm setting according to the patient. Okay, so usually the high pressure is peak inspiratory pressure. We usually set 40 centimeter water, and low usually 3. This value is 10 above 10, so you can set 11, 12. I think that's fine. Usually above 10, and tidal volume. The standard criteria is that if the patient, the tidal volume you set is here. I didn't confirm that, so okay. If 560, and the alarm limit should be plus or minus 100 ml. So maybe this one should be 660, and minus 460. Okay, 460. Okay, but sometimes because the alarm limit is too narrow, so sometimes it's easy to trigger the alarm setting. So sometimes if it's easy to trigger, we can adjust the alarm a little bit. Okay, but this is just initial setting. Okay, and frequency we usually set 35 to 40. 35 to 40. So for example, like 40, apnea 20 seconds. 20 seconds. Okay, that's it. That's it. I think they have another alarm right here. Okay, that's fine. It changes automatically, so we don't need to set it. Audio reset. Okay, that's it. Okay. Okay, so the first step, pre-use check. Second step, select the mode and do pre-use setting. Okay, and the third step is to set alarm. Okay, all of the ventilator are the same. Okay, these 3 steps, and then we can connect with the test lung. Okay, and start ventilation here. Here. To disconnection and check. Wait a minute. So now is volume control. So the ventilator deliver 560 ml of tidal volume at the frequency about 14 breaths per minute. Okay. And because we turn on the assist, right? So if now the patient has triggered, this test lung is hard to use. I just want to show you that if I press the test lung, the ventilator will deliver another breath. Means that it sends the patient's trigger. Okay. We have a leakage over. Okay. And this is the 3rd step set along. And the 4th step is to look at the value. Okay, so this is a value over here. And we can see all of the value here. This is a value. Okay. So the most important things is these two values, especially throttle pressure, this value. Okay. We should keep this value below 30 centimeter water. Okay. So this is the most important value over here. And another value we like to see is tidal volume. The tidal volume is around here. So they have inspiratory tidal volume, is expiratory tidal volume. This tidal volume means that the tidal volume we deliver to the patient. Okay, so this inspiratory tidal volume. Okay, and we set 560. So this volume should be around 560. Okay. Sometimes it plus or minus 2. That's fine. Okay. And this is a tidal volume return back to the ventilator. Okay. This is what we deliver. This is a return back. Okay. So this tidal volume should be similar to this value. Okay. If this value is, for example, like if inspiratory tidal volume is 560. Okay, but expiratory tidal volume is 400. What happened?
There's air remaining.
Air.
Remaining in the lungs.
Yeah. So maybe air trapping, maybe leakage. You have some air leakage, maybe in the lung or outside the lung. Okay, so we need to keep these two should be similar. Maybe it's not the same, but it should be similar. And this similar means that it should be within 50 mils. Okay, should be within 50 mils. Okay, and this is another important thing. So the first you need to see is pressure. Okay, should keep pressure below 30 centimeter water. And second is to look at the difference between the tidal volume. Should be within 50 mil. And the third thing is here, IE ratio. Okay, this IE ratio should be 1 to 2 to 1 to 4. Okay, sometimes because that patient, sometimes I see the IE ratio is inverse. Inverse means that is 2 to 1 or 1.2 to 1. Means that the inspiratory time is longer than expiratory time. Okay, but we should keep the inspiratory time should be short, okay, or it should be lower than expiratory time. Okay, so IE ratio should be 1 to 2 to 1 to 4. Okay, and so you need to remember this value first, and in maybe the week after next we have a lecture talk about the other value. Review again. First, pre-use check. Second, ventilator setting over here. Third, alarm setting. And then connect with the test lung, start ventilation, and look at the value. The first important value is pressure less than 30 30 centimeter water. And second, look at the difference between tidal volume within 15 min. And third, look at IU ratio. Should be 1:2 to 1:4. Okay, yeah, good. So this is initial setting. And the other things I want to tell you is care tubing. Care the patient about the tubing over here. Okay, because this is a dry air from oxygen cylinder to the ventilator. So the patient get the dry, cold air. And this can cause the sputum become sticky, okay? So it's hard to cough. So usually we add humidification over here, okay? So they have this is a heater, okay? So we also need to plug in the heater over here. And then this is a water chamber over here. And I think in this hospital, we put the drinking water, okay, inside the chamber, okay, to this line, this black line, to here. Okay. So sometimes we can see the condensed water in the tube, this tube or in this tube. Okay. So we need to clean the condensed water. Okay. How to clean it? You should. The patient is over here. Okay. The tube should be below the bed of the patient. Otherwise, the condensed water will aspirate into the lung of the patient. Okay, so how to clean it is from the patient to the ventilator. The direction is from the patient to the ventilator. Okay, so we usually hold the tube here, and then pull the tube. Okay, hold the tube and pull, and from this direction away from the patient. Okay, stretch the tube and to get all of the condensed water into this water chamber. Okay, and the other line is the same. Hold it and pull. Hold it and pull away from the patient to get condensed water into this cup. Okay, and then we just screw and pull away. Okay, throw away. Okay. And this is clean the condensed water in the circuit. The other thing is that how can we add water into this chamber, okay, when we connecting the ventilator to the patient, okay. The first things we need to press one button over here, suction, yeah, suction. And this button have some function. The first is that it delivers 100% of oxygen for about 2 minutes, okay? And after disconnecting the line, silence disconnecting alarm for about 2 minutes, okay? So now we can disconnecting the tube and pour water inside, okay? And then after pour water into this line, reconnect it. Usually when we reconnect the tube, it will deliver 100% of oxygen for about 2 minutes. Okay, and you can directly cancel it. Just press the suction button again. Okay, so remember this part. If you like to disconnect the tube from the patient, this part or that part, you need to press this button first, this suction first. Deliver 100% of oxygen and silence disconnecting alarm. Okay, so when you do the suction, the same things. Okay, because you need to disconnect this part, right? Also press this button first, and then prepare your suction machine and disconnect this part and do the suction and reconnect it. Okay, button. Suction button. Yeah, that's great. This one. So it delivers 100% of oxygen for 2 minutes. Okay, and then we prepare suction tube. Here. Okay, and then so we suction the endotracheal tube inside the endotracheal tube first, and then nose, and then mouth. Okay, 3 parts. Okay. Later. Without sedation. Okay, that's fine. That's fine. And we can also use the suction catheter to determine to assess the cough reflex of the patient. Okay, so it's connected, and one hand hold the endotracheal tube, the other hand put a suction catheter inside, and press the suction button here, intermittent press it. And sometimes I will rotate the suction catheter. Okay, and check the vital signs simultaneously. Okay, once again. Okay, still have. No stop. So when I reconnect it, it delivers 100% of oxygen for 2 minutes post suction. Okay. I just wait the vital sign. Okay, it's 100. So let's try. But because she still have some sputum, hold the endotracheal tube. Put the suction tube inside. I think it's 2/3 of the depth of suction tube, and press the suction button. Rotate the suction catheter. Okay. Reconnect it, and suction the nose first. And then mouth. And the other side. And clean the suction tube. To that, all of the sputum collect into the bottle. Okay, and turn off. Yeah, so that's it. Okay. If you like to prevent the setting being adjusted by other people or something, you can press the lock over here. Okay, so now it's locking. Okay. And press and hold. It's unlocked. Okay. And if you like to stand by, press this.
He will finish.
Just come in here. Okay. He's stand by. Okay.
Great.